I want to say one more thing on Quebec. I don't recall seeing vaccine mandates or ever in a church where you can't physically enter the church. I've seen it happen with church halls. I know certain jurisdictions in which pastors or rabbis or bishops have said, no, you cannot preach or participate as a priest or bishop or something if you are not vaccinated. That's their own thing. But to have the state say, no, we're going to bar entry into this place of worship if you're not vaccinated, and what? They're going to expect the clergy and the rabbis and the imams to enforce that? I mean, this seems quite shocking, especially for most religions which say, kind of you make up your own healthcare choices. I find this quite shocking, quite disturbing. Let's pivot to Ontario. So we don't have vax mandates from the government for churches yet, but there were huge restrictions announced. The government suggesting that you not gather with more than 10. Right before the holidays, this was announced. Brock, what do you make of all this?
I think the government is trying to find something to do, and a lot of the times they don't know what to do. And this is what you get when you're not sure of what to do. There's fear in Ontario that the school system's not reopening after the Christmas holidays. Mm-hmm. And kids are going to be forced back onto tablets and computers for a few weeks or maybe months. During the first phase of COVID, school kids in Ontario lost 7.5 months of in-person class time. Kids are falling behind. You've got a society that is isolated. People are tired. They've done what they've been asked to do. They've been promised, as Hannah said, that things will return to normal. And it seems like this is our new normal, and there's no sign of it ending until someone finally figures out a way to make COVID be endemic and figure out how to get society back and functioning at a tolerable level.
But, Hannah, I feel like we're just spinning our wheels. You both have expressed that the more power, in some ways, that the government keeps doing this kind of repeat, wash, rinse, repeat cycle. Mm-hmm. Nothing seems to be improving. Brock, you said very interestingly that, when the government doesn't know what to do, they just do something. And they're doing something, but there are real life impacts here. We know about the mental health tolls. We know about the spike in suicides. We know about the opioid crisis. But we're talking about now families and children and their schooling being disrupted again. They're not going to their place of worship, which for some is a big mental health support. How can this continue, Hannah? And what do you think it'll take for the government to kind of step back and say, maybe we don't know really what's going on and we've got to listen to the people more?
It'll have to be a revolt. And I know that sounds very dramatic for us passive Canadians, but it'll have to be a revolt, and the people have to say enough is enough, and Doug Ford's going to have to start thinking about, re-election. And unfortunately, he's probably looking at the polls and enough Ontarians are still okay with this, but I hope this Christmas is going to break people. Unfortunately, I have to say that it's going to break people and realize that you don't have to listen to the government to go visit your family. And I mean, Dr. Kieran Moore here in Ontario is saying that if your grandparent has 3 doses of the vaccine and you only have 2, you can only visit them outside in the freezing cold. I mean, how is that good for anybody's health? These people are they lost their minds. They're too self-important. And the solution to them is to be put down a notch and realize that the power that they have is only from us. And the people have to say enough is enough. We need to go back to normal. And the issue is they're constantly using the justification that the hospitals are going to be overwhelmed and we have all these cases and stuff. But every day when the number of cases are announced, it's in a few hundreds or whatever, there's only 1 new death or 2 new deaths. You have to look at the deaths and the hospitalizations. And here in Ontario, there's only 284 people in the hospital who've tested positive with COVID, and about 109 of those are in ICU. And all of the hospital executives and our, public health people, I wish they use this time to actually improve hospital capacity, have more beds, figure out the hospital situation, and instead of constantly using our hospital capacity as a threat to people that it's going to be overwhelmed, so therefore you have to stay home. How do we fix the hospitals and allow people to live their lives?
Well, and we all know that overcrowded ERs and hallway healthcare, which is actually, I think, a term that Doug Ford tried to coin, has always been a problem. We've always had a problem with capacity. And of course, they naturally go high in the wintertime when we have high cold and flu season. Pivot for a moment. We have 4 Canadian military members who are challenging a vaccine mandate in court. Brock, tell us what's happening here. We have about 30 seconds before commercial.
They're challenging being vaccinated to keep their active duty role. And I think that this is yet another case where we've got an occupation where there's not enough people. And the courts are going to have to decide. Unfortunately, in this case, I think the soldiers are out on their own. They don't have a union representing them in this case, and I think it's going to be a tough struggle for them to make their case. But if they're ruling out 10% of society, it's tough.